Hi, my name is Maruk. I'm a value-based care consultant, a quality data analyst. I help practices improve their quality scores. In this session, we will discuss about an incentive opportunity which a lot of clinics are missing out on. And if you are a practice and you are in network with WellCare, then you can earn $450 per member under CoC program by WellCare, which is Continuity of Care Program. And we will see how a primary care practice can capture this incentive. Let's dive in. So we will discuss the following. And if you are a clinic, a provider, or you are someone who works in quality improvement department, you might have these questions. You might already know about continuity of care program, but these are the things we are going to discuss, which is what is continuity of care program by WellCare, how it works, and what can I do as a clinic, any process for appointment agenda, submission, which is part of this continuity of care program. How can I submit WellCare agenda for my clinic? How to know if I submitted accurately? And then I will show you sample agendas and how to submit them on portals and different submission options as well, right? So let's see. Let's keep going. So in session number 3 of our series on how to actually close care gaps, remember we discussed how attending pair quality meetings can help your clinic effectively close care gaps. And I will link that session in the description of this video so you can go and check that out again. In that session, I pulled up this dashboard from Fidelis Care for a sample practice, right? The reason that I am showing you this performance dashboard again is because here in the bottom section, you see top 5 opportunities overall for this clinic. And you can see here something called CoC, which is appointment agenda. And you also see a $0, which means that this sample practice earned a $0, right? Because there's a lot of confusion around, how to submit the agenda and where to submit. Can we submit within our EMR? So let's see how we can capture this particular incentive opportunity, which is right here in the bottom, which is CoC, appointment agenda submission. This is what we are going to see today. Let's keep going. So I will quickly discuss some basics of appointment agenda under the Continuity of Care program. This information is also available in the Continuity of Care program manual, right? So if you are a clinic in network with WellCare, Fidelis Care, and you have a quality improvement specialist who is already actively taking pair quality meetings, then there is a high probability that you already know about WellCare's CoC incentive program for providers. And its purpose is simple: to reward primary care providers for proactively managing their patients' health and for thoroughly assessing all of their conditions, right? So this in front of you, I took this from the manual. My goal here in this session is to actually show you agenda, how to submit it in the portal, and to basically create a process to make it easy for the clinics. So you might find some basic information before we get to the actual agendas and before I show you how to submit them on the portal and tell you about some submission options. So just hang in there. And this again I took from the Fidelis Care's Continuity of Care program manual, in which they tell you how it works. Basically, providers, they earn bonus payments for completing a patient's appointment agenda, which is a tool that helps track health history, conditions, and preventive care needs. And how the members benefit from it. Members, they are receiving more proactive and comprehensive care for their chronic conditions and preventive needs. So it's an overall assessment of a member's health, right? Rather than just one measure. That is why it's a complete agenda, or it is a form that has all those conditions which the provider has to assess. And how the providers benefit, obviously they benefit because they earn additional compensation for their efforts to improve members' health, right? So now let's do a little bit of a deep dive and a little bit more about the appointment agenda. Okay, so although notice that if you are a clinic, although you can earn a maximum of $450 per appointment agenda, but if you are not completing it, you may not get the full $450, right? And it sometimes depends how much you can get, but the maximum that you can get per agenda is $450, right? So maybe you submitted agenda after the patient visit, but the claim was never received. So in that case, you don't get anything. Another situation can be maybe the agenda was submitted, the claim was also received, but the claim did not have appropriate diagnosis codes, which means that the conditions or the measures in the agenda were not assessed, right? And also know that, electronic submissions, they get better incentive amount rather than the paper-based submissions. Okay, we are going to talk about this later on when we are discussing the types of submissions. And this threshold that you see here, this threshold, this is from WellCare, and it refers to the minimum number of completed appointment agendas that a healthcare provider must submit within a certain time frame, okay, to be eligible for the quality of care incentive. So you are looking at this date here, but you also see that the date is subject to change. So the continuity of care was there in 2023 as well, in 2024 as well, 2025 as well, and it will be, I'm hoping it will be around in 2026 as well, right? So these are the dates that you might want to check with your provider relations associate and confirm the deadlines, okay? Because they are subject to change sometimes. So just look into that and confirm. Back to what we were discussing in the threshold there. So let's discuss about what this means, right? So if your practice electronically submits more than 80% of the completed agendas, then they will get $300 per agenda, right? And if they also completed additional sections like health risk conditions, care guidance, etc., then they receive an additional $150, okay? So now we know how the max amount per submitted agenda is $450, okay? Max potential is $300. And if you fill out the additional sections, you get a bonus of $150. So it's a total of $450, okay? So here at the bottom, we have some, statuses. And we have different statuses that can be assigned to agendas, okay? For this sample practice, by the way, this is a sample practice that received 15 appointment agendas, which means that they had to address 15 patients, okay? So for this ABC sample practice, WellCare created 15 appointment agendas, meaning 15 patients. Let's do a little bit of math here. 15 agendas and multiply that by 450, which means that the incentive amount in just 1 month, because this is created on monthly basis, right? I was going into quality meetings monthly, and every month I had some appointment agendas that the practice had to consider or address those patients, right? So anyways, let's go back to our math. 15 times 450, which is 6,750, right? So this practice had the potential of over $7K from just 15 patients. Okay, if you know who are these 15 patients and your practice can put a system in place or can put these 15 patients on priority, then you can easily capture this 6K plus dollar within 2 weeks. Yes, you can. And here at the bottom, we see other statuses as well, which is distributed, received, payable, paid, completed, but not paid. So these are all the statuses which are assigned to an appointment agenda. And by the way, when you will go into quality meeting with your provider relations associate, they will tell you about this incentive opportunity that, hey, these are the patients and their care gap is appointment agenda, which is that you have to address all of these conditions within the agenda. And they will also have a status column for the agendas, and these will be the statuses. And what these mean, we will see. Let's discuss about this 4-step process to close appointment agenda. So whenever you see that a patient has a care gap type appointment agenda, then you have to follow this process. You schedule that patient and assess the conditions on the agenda, let the provider fill out their agenda, and submit the agenda electronically. And then do not forget to submit a claim, because without the claim, there is no proof that the conditions or the care gap measures in the appointment agenda were ever assessed. So claim is essential along with the submission of the agenda to be able to close this care gap. And there is a reason today that I have decided to do this appointment agenda based session, because there are a lot of care gap automation platforms out there, and I would really like to know how they are closing this type of opportunity with their automation platforms, right? And this is a discussion for the next session, but let's stick to what we have right now. So okay, so we know what is appointment agenda. We know that our clinic can earn $450 per agenda, but where are agendas, right? Where are agendas? And who will give us these agendas? All of this information you can also find in WellCare's 2025 Continuity of Care Program Manual. So just search WellCare's 2025 CoC Program and you will get all of the information. The practices that I work with, I get these agendas every month from the provider relations associate. And I will show you one sample agenda, and I will show you my Excel sheet as well, which basically tells the care gaps. And I will show you that this is a type of care gap that I used to get, right? So let me show you now. So here in front of you, I have this care gap list that I got from Fidelis person. And in the left, you can see that the gap type here is CoC. So there are different care gaps. We have CoC, we have annual preventive visits, which is APV here. And we have member without visits, which is MWV. So they have abbreviated it. But this is a type of care gap, okay? And you see here the measure is appointment agenda. And here you can see that the potential remaining, it also tells the amount that is remaining, and what is earned is $0 by this clinic so far, the sample practice. So this is how I know that these are my appointment agenda patients. But there are other ways as well, which I will tell you and I will show you. And let me show you an actual agenda. So when I had quality meetings with the provider relation, not only will they tell me about the appointment agenda patients, they will also hand me out those agendas. So they will give me in PDF those agendas, which I will show you um, so that you have a better idea. So here you can see that this is a sample agenda and this is for a sample patient, right? So I actually got rid of all this patient information. I highlighted that. Any personal details. And this is the additional section, by the way. Remember, we discussed that the providers, they get an additional $150 bonus for filling out this section, which is health conditions history and high risk conditions. So if you fill out this additional section, you will get what? $150 bonus along with $300 for submitting this agenda. And let us go down and let us see. So these are all the things that the provider needs to assess. And we have health outcome survey, we have, preventive screenings as well. And at the end, we have provider signature. So this is the agenda. And I will show you the same agenda again, but filled out by the provider, right? Because I want to show you how it works. But anyways, for now, this is a sample agenda and I show you how would you know from your care gap list that you have this type of care gap, okay? So let's keep going. So once you have completed your agendas, you have to submit. And this is where a lot of clinics, they get confused. How do we do that? How do we do that? How to submit? Okay. Do we use Rx Portal? Do we submit through WellCare Portal, which is also an option? Do we send them an email? See, the providers, they usually don't prefer if they have to do anything outside of the EMR portal, because the patient is sitting in front of you on the date of their visit and you are going into these different portals and not actually communicating with the patient. So if you have to go outside of EHR portal and the patient is sitting in front of you and you are trying to, go into these different portals to submit the agendas, this is not contributing to patient engagement. This is actually patient disengagement, right? So that is why we have quality departments who are managing quality portals. So there are majorly two methods to submit the appointment agenda. One is electronic, which will include submissions through provider portals, and it also includes EMR push. And another method, which is paper-based, which is that, you email them the filled out agenda, you fax them, or there's a spreadsheet submission. But anyways, method 2, it is not as preferred because not only will it increase the processing time, but it also reduces your incentive amount, right? So you might want to stick with method 1. And so I recommend that you stick with method 1, which is electronic submission. And in electronic submission too, let's get a little bit deep. The best method is EMR push. So what we are doing here in EMR push is basically the appointment agendas are getting synced into your EHR, right? Such that the provider will not have to go to different portals, or there will be not a lot of hassle. Because once the appointment agendas are synced into the EMR, and you have to discuss that setting with the provider relations associate, they have that. And this I thought I would just add a screenshot for you. So they just asked me about the EMR that we were using so they could integrate the agendas into the provider's EHR, right? So this is possible, EMR push. So another way, but however, as I mentioned, that EMR push is going to take time, right? So let's say that, the EMR push is underway and it is taking time to set up because it will take time. So while the EMR push implementation is underway, you can attach agenda in patient documents and mention on patient chart in chief complaint so the provider knows what to do with the agenda that they are receiving. Okay, so maybe you can mention on the patient chart, complete and assess all the conditions in the appointment agenda and scan back the completed agenda in patient documents. This method is not as intuitive, but many practices they use this while the EMR push is underway or that setup is happening on the back end. So what is happening in this particular method is that the quality manager coordinates with the front desk and the staff will print the appointment agenda and they will put the agenda in the provider's office once the patient has confirmed visit, right? So the provider fills out, and so any staff or PA, they will scan and attach that back in patient documents in EHR. And later on, the quality folks, they will see those agendas, right? The ones that the provider filled out, and they will submit those in different portals. Okay, let me show you what are different portal options that WellCare gave for the submission of appointment agendas. Let me show you FAQ on appointment agendas, and this is really helpful questions that your practice might want to address with the agendas and how to fill those out. So basically, I want to show you this, which is submission type, right? So for electronic submission, we have option, which is through the portals. You can submit on WellCare portal. You can submit through Rx portal, which I will show you, right? You can submit on Availity. So these appointment agendas for your practice are available on all these portals, right? So let's say once a provider filled that out and scanned that back in patient documents, then the quality department or the quality people from your clinic, they will go ahead and then submit those electronically on these portals. Okay. And we know, which we already discussed, there are paper-based submissions, which are here as well. Not as intuitive, takes longer to process, reduced additional compensation amount. And this is the one that we were discussing, the EMR push, which is the preferred method. And you might want to discuss the EMR integration, right, with your provider relations associate. You can search this, and I found it online, and you'll be able to pull out this manual as well. Now, remember earlier I showed you a sample agenda, right? So this is a sample agenda which I showed you. And now this same agenda is here again. Here again, this is the same agenda, but this time it is filled out by the provider. Okay, so the agenda is filled out by the provider, but ouch, you see what the provider did here? They did not assess this section, and they just cut it out. So, I don't know. So they did not do anything. They did not mention anything what was done about this condition. And this is the additional section that we discussed earlier, which will get you a bonus of $150. So this provider missed out on that, right? Because they simply cut it out. Let's go down. What else they did? All right, so here they put their signature, which obviously I I'm not showing you. What else do we have? Let's go on top. Yeah. So these are the additional conditions on the agenda for this patient, and the provider assess these conditions, right? But again, it's good that the provider assessed these conditions, they filled that out. Also, they missed out an additional section which could have added a $150 bonus. But anyways, this is the agenda filled out by the provider. Now, the provider filled out this agenda, and someone in the clinic, they scanned that back in the patient documents. And what I will do, let's say if I was in the quality department, or you have someone who is managing all those provider portals, then what they will do now is that they will go into one of these mentioned portals, which are mentioned by WellCare here. It can be Rx portal, it can be WellCare portal, it can be Ability, and they will submit the agenda. Okay, and I will show you Rx portal. Let me show you Rx portal, and let me show you that it already has all those agendas which are assigned to your practice. So here we have Rx portal, and it shows you all the appointment agenda and their statuses. I want to show you this portal because it will make this really easy for you. So let's go inside. I will log in, and so here we are inside the Rx portal. Okay, and from here what you can do, you can go to your patient list, and here you see on the top appointment agenda. So click this, and it will show you all your patients that have appointment agenda, right? So, and it will tell the status as well, whether they are contacted and what you did with them, right? So let's click on one patient here. And here you can see that we have same agenda here as well. Okay, so for example, the provider assessed all the conditions and they scanned the agenda back. Then anyone from the quality department, they can come here and fill out all these conditions here, and then they can submit, right? And yeah, so that will be a submitted status on your end. And you can see all these agendas in the WellCare portal as well, but I prefer Rx portal because this is really helpful. This is simple, and it has a lot of things that help you to keep track of the medication adherence measure as well. So now let's go back and see the statuses. Remember, we discussed the statuses of the appointment agendas, right? So now we will see what are those statuses, and let's discuss a little bit more about those. Okay, have you submitted your agendas correctly or not, right? And if you did submit, what happened to that submission? So there are these certain statuses for appointment agendas, which is called agenda status, which you see here. And the status can be distributed, which means that no claim received, no agenda received, which means that they have not received claim and neither the agenda, right? So another status can be held, conflicting documentation, and held, no documentation. So which means that agenda was received and at least one code on the claim closed out a condition on the agenda. The agenda is held because either they confirmed the condition but did not document it on a claim, or they did not check all of the boxes on the agenda. So these are all the statuses, okay? And I will show you the care gap sheet again, where you can find this column agenda status, where you will be able to know what happened to your agendas? What is the status assigned by the pair to your agendas? So let me show you that care gap sheet that I received from my provider relations so that you will know the status of your agendas as well, okay? Okay, so here, once again, I've pulled up this for you. The gap type is continuity of care, measure is appointment agenda, and major status is incomplete. Remember the column that we just saw, which was agenda status? So we have this here as well, the COC status. And the status here is that it is distributed. So all of these are distributed, which means that agendas were distributed to this clinic, but they have not done anything about the agendas. They have not submitted claim. They have not submitted agenda. So this is about appointment agenda. It is a really good incentive opportunity. And if your clinic needs any help in closing those appointment agendas, then I would be happy to coordinate with you on that. And if you are already closing appointment agenda care gap, then I would be happy to know how you are closing those appointment agenda care gaps. And in the next session, we might look into how care gap automation platforms, how AI care gap automation platforms are submitting appointment agendas, and whether the pairs allow any AI-based submission or not. So we will see whether these AI-based care gap automation platforms, whether they are submitting this specific opportunity, are they capturing this specific incentive opportunity, and if they have something where the clinics are able to submit the agendas through automation, and we'll see how progressive are the care gap automation platform and if they are, right? So stay tuned.